Cure these heart diseases to prevent heart attack in women. While women and men share many of the same risk factors for heart disease, there are also many important differences. Knowing these differences can help you to protect yourself against having a cardiac event. High blood pressure. Women and high blood pressure tend to go together. The reason is that women have smaller blood vessels. Plus, women are more likely than men to have diastolic dysfunction, making the deadly side effects of high blood pressure in women a much greater health risk. Menopause. The reason is that during menopause, estrogen levels drop, and estrogen is what keeps your arteries flexible and strengthens your arterial walls. When your estrogen declines, your blood pressure is likely to rise. Plus, estrogen is associated with the production of good HDL cholesterol that protects against heart disease in women. Therefore, as estrogen declines, so can HDL cholesterol. Being 20% or more over your ideal weight is a significant risk factor for heart disease in women and men, and losing even a few pounds can improve your heart health. That's because shedding unwanted pounds helps to reduce your inflammation levels, lowers your blood pressure, reduces your risk of developing type 2 diabetes, and decreases your risk of having a heart attack or stroke. Leading a sedentary lifestyle, inactivity can raise your risk of developing high blood pressure and diabetes, both of which can contribute to heart disease in women. Since women and high blood pressure are so closely related, staying active is very important. Diabetes, heart disease and diabetes are closely related for both men and women, but women with diabetes are twice as likely to develop heart disease as men. Plus, women who have type 2 diabetes are more likely to have a heart attack at a younger age than men and have a greater likelihood of dying after a first heart attack than men. Smoking. While smoking is hazardous to everyone's health, it's even more dangerous for women than it is for men. Women who smoke have a 25% higher risk of developing coronary artery disease than men. Even smoking just one cigarette a day can significantly raise your heart disease risk. So, if you smoke, you want to take steps to quit. Stress. Research has shown that mental stress can affect women's hearts very differently than it does men's hearts. Women who have experienced mental stress are more likely than men to have myocardial ischemia, reduced blood flow to the heart. They are also more likely to have blood platelet aggregation, early blood clots. How women can prevent heart disease. The good news about women and heart disease is that there are many things you can do to prevent it. Taking these simple steps can help you to ward off heart disease, as well as prevent high blood sugar and diabetes. Take heart health supplements. To prevent heart disease in women, we recommend a good probiotic and multi-nutrient formula, one that's rich in antioxidants and B vitamins. We also recommend taking the following heart health supplements in divided doses: broad-spectrum magnesium, 400 to 800 milligrams. CoQ10 in hydrosoluble form, 50 to 100 milligrams for prevention, and up to 300 milligrams if you have a heart condition. D-ribose, 5 grams for general energy support, 10 to 15 grams if you have heart failure, cardiovascular disease, peripheral artery disease, or stable angina. Omega-3 fatty acids, 1 to 2 grams for prevention and 2 to 3 grams if you have heart disease. Keep your blood pressure in check. For both women and men, a healthy blood pressure level is less than 120 millimeters of mercury, 80 millimeters of mercury. If you're one of the many women with high blood pressure, you want to take steps to proactively lower it, including modifying your diet, taking blood pressure supporting nutritional supplements, exercising, and reducing stress. Use over-the-counter painkillers with caution. Research has shown that daily use of over-the-counter pain relievers such as Advil and Motrin, ibuprofen, and Tylenol, acetaminophen, can contribute to high blood pressure in women. Just 500 milligrams of acetaminophen per day can put women at a 93% to 99% greater risk of developing high blood pressure within 3 years compared to women taking less than 500 milligrams. Get moving. Getting regular moderate exercise is one of the best ways to ward off heart disease, and one of the most powerful exercises you can do for your heart is walking. Research has shown that women who walk briskly for 3 hours per week can cut their risk of a heart attack by 40%. Walking 5 hours per week can cut the risk of a heart attack in half. Eat a heart-healthy diet. To keep your heart healthy, you want to eat a heart-healthy diet. This means limiting, or better yet eliminating, simple carbohydrates, sugars, and trans fats from your diet. Reduce stress. Stress can wreak havoc on your heart and entire body, so it's important to take steps to mitigate it by minimizing the number of stress triggers in your life. You can also help to diffuse stress with exercise, yoga, tai chi, meditation, and grounding. If you smoke, quit. Women, heart disease, and smoking are closely related. Quitting can help your blood pressure and heart rate within just 20 minutes. After a month of not smoking, your blood flow will begin to improve. Then, 12 months later your heart disease risk will drop by half, and 5 years later your risk will be equal to a non-smoker. What to do if you think you are having a heart attack? For women with heart disease, it's important to know what to do if you think you might be having a heart attack. Chew an aspirin as soon as your heart attack symptoms begin. Aspirin can help to break down possible blood clots. Also, take nitroglycerin if it has been prescribed for you. Call 911. Don't drive yourself to the hospital or count on a friend or family member to drive you. When you call 911, cardiac care begins as soon as the emergency medical technicians arrive, and continues in the ambulance on the way to the hospital. Once at the hospital, don't let the doctors and nurses dismiss your symptoms. You don't want to waste valuable time by having them dismiss your symptoms of heart disease as stress, anxiety, or indigestion. You want to be very clear about your symptoms and insist on getting a full cardiac workup.